Dr. Jim Augustine, DocTalk. We're ending January. A very good tone to what is going on the last week. That is good news for all of us. With a number of news pieces that say the incidence of COVID is going down across the country. The incidence of influenza is not increasing. Our other respiratory infections at typical winter levels. We haven't seen an overwhelming number of cases in schools. That's a good thing. We have not overwhelmed completely our hospital system, although everyone knows that some of the systems are really stretched. And our health system overall has been described as a dumpster fire. How typical is that in our industry that we describe something as a dumpster fire? Views of things I'd never like to see: garbage dumps on fire and dumpsters on fire on the engine. Those were not the things that you ever wanted to run across. And so a dumpster fire in the healthcare industry and in hospitals is not where we want to be. So regionally, some of you still very busy times. Regionally, some of you have come way down the curve on Omicron COVID. That's good news. There's this idea that there's a portion of Omicron that is more infectious potentially and is hard to find on our typical testing. Don't let that disturb you. It doesn't mean that there's new cases going to sweep across in people who are protected. Protecting this week, I'm going to reinforce this point. 3 immunizing events. 3 immunizing events means you got sick and then got 2 vaccines, or you didn't get sick, you got 2 vaccines and then a 3rd vaccine. 3 immunizing events is what we like to use for very, very good protection from coronavirus infection in the future. All of you who've been in this industry long enough know hepatitis B. Vaccinating 3 times protects us from hepatitis B for a long, long time. And we don't even know how long, because some of those original people who got the immunizations 30 and 40 years ago now have never come up with hepatitis B. And in my career working with a lot of big fire departments, I haven't seen hepatitis B new cases in many, many, many years. So that's good news. All right. The topic of the day today is: how do we read numbers and how do we protect ourselves? I want to look at the data coming to you and realize there's 3 elements that are really important to you. One is cases. And that's when any kind of a virus or other illness is spreading through the community. It's nice to know the number of cases, because for us in fire EMS, that typically means we're going to see a certain percentage of those people. Typically, those people who are at risk for one reason or another are the people that we see more of. But anytime a disease is spreading through our community at a higher rate, we see more of it. Number 2 is how sick are they? And how sick reflects in COVID with how many get to the hospital, how many go on ventilators and in an intensive care unit. And then the 3rd parameter is how many die. What we are always protecting against is infection that is serious enough to cause people to go in the hospital, go in ICUs, go on a ventilator. That's what we want to prevent. And that's what is highly prevented by 3 immunizing events, by the vaccinations, and at this point by people who've been sick with some form of coronavirus before. The numbers of deaths are going to continue to go up. And that's the news in the headlines this morning is coronavirus-related deaths continue to go up. Many of those deaths are hangover cases still from Delta infections that occurred in, frankly, even November and December. So those Delta variant people who got a lot sicker, a lot quicker, particularly unvaccinated, and those individuals have been through various forms of medical care and at this point, unfortunately, are dying. Some of them are still in the hospital in the ICUs and dying there. Some of them have made it to a rehab facility of some kind. So the headline is still about people dying of COVID. And I want you to realize we lag very much in getting those numbers, and those are going to go up for a while. The other concerning thing that you will continue to hear is about the death penalty. And the death penalty talks about how many people usually die in this country and how many people are dying over the last 2.5 years. There are more people dying in this country than were dying in this country in 2018 and 2019. That is the tragedy of coronavirus and the pandemic. They're dying not only of COVID, but in some cases from complications of COVID that occur down the line. In some cases, it's from people who could not get their routine medical care because of the disruption of the healthcare system. That death penalty from the pandemic is going to continue probably for 2 more years, just so you're aware of it. And that reflects people who didn't get cancer screenings, who otherwise would have gotten cancer screenings, who didn't get heart procedures done when they needed heart procedures done, who didn't get GI procedures done and their scopes and stuff done because the scope center was closed, and extends across all types of diseases. We still have our children in a very low risk state for coronavirus, although the numbers this week say Omicron affects children at a much higher rate than the prior variants of coronavirus. I want you to be aware of that so that then you can read the numbers about coronavirus infections going into children's hospitals and appreciate that Omicron is more dangerous to them than the prior variants. Okay, the topic of the week in questions that I've been receiving is, Doc, tell me about masks. Tell me about masks. I've gotten so many conflicting reports about what type of mask to wear and why. And then even through my workday, I go from one type of mask to another type of mask to another type of mask and what really protects me. So I brought high-tech demos here. Cloth mask, traditional surgical mask. This happens to be a KN95, but an N95 as well. I don't have respirators and canisters. All right. These are our 3 most common. I always think for firefighters, think through this about going into a fire. And you're asked to protect yourself from products of combustion. You can go in naked, no mask. You can go in with a cloth mask on. You could go in with a surgical mask on. You could go into KN95. You could go in with a canister respirator, or you could go in with self-contained. You tell me how you want to go into the fire. So we have a virus that is very, very, very infectious. It is infectious not only in droplets, but in aerosols. That means it hangs in the air for longer periods of time, although not an impossibly long period of time. And it doesn't live on surfaces at a high enough rate to get a lot of people infected. When you put a cloth mask on, you do a couple of things. Number one, it begins to filter stuff that is coming into your airway, either through your nose or your mouth. That material filtered through this has larger pores to go through, and typically a loose weave to most cloth masks allow you to breathe a lot more easily. These are not fitted, and so there's crevices around big fat noses like mine, or pointy noses, or any other kind of nose. There's crevices, and so, if you will, fresh air comes in, and a lot of times these aren't fitted very nicely, and so a lot of air comes around. Number 2, when you're coughing, sneezing, or just speaking, what really happens is this catches on the interior surface a lot of that material. So that's material that ordinarily is spray coming out of your mouth and your nose, and it's caught in here. So if you think about the people around you, or if you took high-speed pictures of material coming out when you cough, sneeze, or speak, you'd find a ton of that material is caught in here. So cloth masks are really good at preventing you from spreading stuff outside. They're a little bit good for protecting you from stuff coming in the inside. A reminder, we are not talking and protecting you about individual little single pieces of virus going through this mask and into your airway. Little single viruses do not cause infections. Little single viruses do not cause infections. You need a pretty good glob of viruses hung together into your respiratory tract, surprising your respiratory cells and your protection, not getting immediately swept away by you having mucus and other things. You need pretty good quantities going through. Any kind of mask protects you from large quantities, as long as it's worn appropriately. Two pieces. Number one, when you wear it like this, you oftentimes are breathing a lot in through your nose, and you're completely unprotected. So that's a naked nose, stuff gets in. Everybody should realize, and I didn't bring a face shield, but you get a minute amount of material that comes onto the surface of your eyes. The surface of your eyes is covered with a liquid, your tears. Those tears are produced upper outer and sweep across your eye and go to a drainage tube that is right next to your nose and then gets right into your nose. As you know, when you cry or produce tears in any way, that material goes into your nose and eventually you either swallow it or you cough it out. So that is why, at least theoretically, face shields plus masks prevent you from getting more material coming in towards you. And that is the greatest protection. Cloth masks have a certain degree of protection that's very important. And it's important because I can't spread stuff to you, and I filter a certain amount that's going to come into me. All right, for many years, these are called surgical masks because they've been used in surgery. The design of these are to protect the patient from the surgeon, as well as protecting the surgeon from the patient. If I cut this into pieces, okay, you would see an inner liner. So it's the non-colored side, the white side of surgical mask that is absorptive material. That absorption is to keep you from snotting or coughing onto the patient. So it is an absorptive layer. It has a middle layer that's even more absorptive and an outer layer intended to protect you from spatters coming from a patient, material that then doesn't come into your respiratory system. Surgical masks have typically a little metal band that allows it to form more perfectly around your nose. And it has straps that keep it a little more tightly in place. Although surgical masks, when worn appropriately, filter a lot more air than a plain old cloth mask. They still allow air to come in through ports, typically in the side, and because not a complete seal around your nose and up underneath. And if you sneeze or cough really hard, that air doesn't get all filtered out. A certain amount of it will go out through the edges. And that's how you can be infectious to others, even though you have a well-fitted surgical mask on. This provides a lot more protection. The pores have a tendency, because it's multiple layers, to be Swiss cheesy and for you to catch more and more particles trying to come in, especially bigger particles. Not individual viral particles that do not cause infection. We're protecting you from globs of that. In some ways, people who wear any kind of glasses, so I'm of the age group that needs reading glasses, these provide a certain amount of protection, but they're very inconvenient to wear for a long period of time with the mask because every mask glass combination causes fogging. And for you guys who wear the combination mask plus a shield over your eyes, you're like pulling at that thing all the time because it's constantly fogging that plastic material that is shielding your eyes. All right, what's the advantage then of our next level masks, which we typically use, which is the N95 or the KN95. KN and there's some other variants. It means it filters 95% of incoming particles. That's a good thing. It has to be fitted, and there's different sizes of these. And me with a fat face, fat nose, there are certain N95s that won't fit on me. Those of you with small or narrow faces have to have a different fit. And so typically in our organizations, we have a couple different types of N95 masks intended for different size people. We have some N95s that have really, really good nasal fitting pieces and many much more complicated webbing that holds it firmly in place 360 degrees around. In small people, a lot of them will wear a mask so that the chin piece is actually up over their chin. In other people with bigger faces, it will fit down below, but you have to have the right fit. And for those of you who wear these for extended periods of time, you find that some additional webbing fittings that don't just tear up the back of your ears is really important. You also know that these fit a little more snugly and create pressure against your upper cheeks. And so you see a lot of people with what look like scars now from wearing N95s for so many hours and breaking down the little blood vessels here across their cheeks. Again, we have higher level canisters and respirators that can be used. The dangerous ones are the ones that have an exhalation valve right on the front. And it's like a howitzer projecting your excretions right to the person who's in front of you. And they've asked us not to wear any of those canisters or respirators that have exhalation valves. Those are intended to protect from a different group of substances. Those are typically prepared for a chemical environment of some kind where you're not worried about what's coming out of you. You're worried about protecting from what's coming in. So, and KN95s, N95s intended to protect incoming. They also obviously protect very well from outgoing, and they are multi-layered, again, with the resistant part on the outside, the absorptive part on the inside to catch your secretions from going out. Masks, really an important part of our defenses for right now. We think we are in a waning phase of Omicron and maybe overall for the coronavirus pandemic. We will keep going in about week-long periods of time. The cycles are getting longer, again, for news coming into the industry about the disease. We have been on a period of time where we were in 12-hour cycles of changing news. We're now at about 2-day cycles. That's a good thing because it means trends are moving in a certain direction. I hope we are going to move into the springtime months in much better state than we are today. And that will allow us all, again, to return to normal life, normal operations, begin to enjoy our time together. DocTalk, end of January. Stay healthy, follow the protocols, a couple weeks to maybe a couple months more. Keep yourself safe and protect your community. Thank you very much.